Thanks. Awesome. Can everybody hear me okay without the mic? Okay, awesome. Well, thank you so much for that intro. My name is Danny. I work with InMode. I am a master esthetician and have been in aesthetics for years. And coming over to InMode was a no-brainer for me once I saw the results. And what I do is I just travel around the country and I do patient education. So I teach you about our technologies, talk you through what you want to know, how it works, why it works, who it's best for, and answer any and all the questions that you may have to understand if this is the right treatment for you or not. And then, like we said, this evening only we'll be doing those micro consults if you have questions. We'll also be doing a Q&A after this as well. So if you have questions that aren't specific to your treatment plan or your specific body or areas, feel free to ask those at the end of this. Chances are if you have a question, the person next to you has the exact same question or hasn't even thought of it yet. And so we'll open the floor for questions as soon as we're done. Let me see. There we go. So what is Body Tight? So we are going to be talking about a couple of different technologies this evening, and sometimes it can get a little confusing. So like I said, keep those questions in mind if you have anything. But Body Tight, or our radio frequency assisted liposuction, which is your first question on the quiz at the end, is a minimally invasive right? A minimally invasive treatment option for patients that are looking to remove any unwanted fat and tighten the skin. Really, what we're able to do with this is sculpt, define face, neck, chest, body, anywhere you have fat tissue or anywhere that you have excess or unwanted skin or lack skin, we can really address with our radio frequency assisted liposuction, and it's completely customizable. So we'll talk a little bit about how it works in our layman's terms. So really, what this technology is utilizing is radio frequency energy, which is an energy or a technology that has been around since the early 2000s. It's been FDA cleared. The issue with this previously for utilizing it in skin tightening is that sometimes it was painful. And so what InMode has done is we know this technology works. How can we make it comfortable? We just get too nice and numb. But really, what the treatment itself does, so radio frequency or heat energy, what it utilizes is that energy. And I want you to think of your skin as a piece of raw bacon, which is not ideal. I know we're talking about our skin and fat, but it's loose, it's lax, it's flimsy. There's a ton of extra fat tissue on it. The second you add bacon to heat energy or a hot pan, instantaneously that fat tissue melts away, and then the bacon itself becomes nice and taut and firm. That's what we're looking to do with our tissue or our skin. So we're looking to utilize that radio frequency or heat energy, melt away any of the excess fatty tissue, the dense skin cells that we no longer need, and turn them into waste where our body can just naturally excrete them, or if needed, we can add a little aspiration and suck that extra fat out. And then additionally, that heat energy is going to leave that tissue nice and taut and firm. We're remodeling it so that it's lifted, it's tight, it's firm, and it has that rejuvenated, younger appearance. So we're just utilizing that technology. You can see here these tiny little probes that are inserted into the skin, and that radio frequency energy is just bouncing right in between this external probe and this internal probe. So we can get extremely precise with where that energy is going, what areas we're looking to treat, what fat tissue or skin tightening we need, and we can really customize from there. This is just talking a little bit about that aspiration portion that we talked about where, if we need to go in, if there's extra fatty tissue and we melt that away and, it's not something that our body's just going to be naturally able to excrete, we can go ahead and use that aspiration to suck it out and then continue with the skin tightening, leaving that tissue remodeled, tight, and firm. And similar to the way that your body responds to maybe a burn, you're left with, this nice fresh skin because our body says, oh no, we've been injured, we need to send new skin to this area. So not only is it going to be nice and taut and new, you have nice new collagen elastin building to keep that skin tight over time as well. It is safe on all skin types and tones as well, so that's a question I get asked pretty frequently. It's not a laser technology, it is radio frequency or just heat energy, so we don't have to be as careful as we do with other technologies on the market, so that makes it very unique. So again, some of the reasons why patients are loving the radio frequency assisted liposuction or Body Tight is that you really have that improved body contouring. So you guys saw, the larger hand piece. We also have these smaller ones, and we'll talk about about those in just a second as well. But we can get very precise in the areas that are bothering you. Again, it's going to be minimally invasive. So you're just creating a tiny little micro incision where that cannula or that probe is going to be inserted into the skin. So for patients that maybe don't have a ton of extra time for, weeks of downtime for surgery, or maybe they're just not ready or they don't need it, maybe they don't want to go under general anesthesia. These are all reasons why the radiofrequency assisted liposuction is a great option for patients. So again, we've talked a little bit about the customizable pieces, but we have our body tight, which is that larger probe that's going to be used for abdomens, thighs, some arms, different areas of the skin there. Face tight is a little bit smaller, so we can treat jawline, we can treat jowls, we can treat, other areas of the body that maybe aren't as large as that body tight portion. And then our AccuTite is really small and precise for patients. So we can get into, under eye bags, or if you have the bra fat area that bothers some people, or just a little tiny area that we need to be really precise. We have different options. So this is completely customizable for each and every treatment, depending on the area of concern, depending on, where you're at in your journey and why, and what areas you'd like to have treated. So the treatment itself kind of works. You'll come in, you'll have your pre-consultation, make sure that you feel really confident moving forward, that you understand your treatment plan with your surgeon. And then the day of your treatment, you'll come in and you're going to get nice and numb. So they're going to use injectable numbing. You're going to feel really numb. But again, it's just a local anesthesia. So no general anesthesia needed for this. And then the treatment itself can really range just depending on how many areas we're treating, the size of the area, how in-depth the treatment is going to be itself, if we need to add aspiration or not. And then post-treatment, so typically you're going to be wearing a compression for 1 full week following the treatment. So still a little bit of downtime. I like to call it social downtime. So in comparison to a surgery, you're going to be wearing that compression, but most patients feel really great even immediately after. You're going to be a little bit numb. You might be a little bit sore, and you definitely will have a little bit of swelling or bruising in those areas. And then again, you'll be wearing that nice taut compression for 1 week for 24 hours a day. And then after that week, you'll want to wear it just when you're going to bed or on your downtime to really optimize your results. So oftentimes patients, once that swelling goes away, which can last a couple of weeks for some patients, and again, it's pretty minor swelling for the most part, or the bruising, patients will immediately start to see results. So oftentimes for patients, we're taking out some of that fat tissue, we're melting that away. You can see even off the table results for some patients depending on the area and the severity of the treatment. And then additionally, you'll really continue to see those results over a period of time. So 6 to 12 weeks is where things start to really ramp up. You'll start to see the tightening, the swelling's gone down, almost fully back to normal, and you're really starting to see things lift and tighten. You'll start to see that fat tissue break up, and that's going to continue on for about 6 months post-treatment. So again, you'll really start to see that optimization about 3 months and then 6 months, and that will continue on getting a little bit better, getting a little bit tighter for even up to a year. We'll dive into some before and after. So we're going to look at these in kind of categories based on those 3 different customizable options that we talked about. So first is going to be our face tight patients. So you can see very dramatic results here for patients with some pretty severe laxity through the neck, the jawline, jowling, lifting. This is 2 months post and then 10 months post. So you can see great results even 8 weeks following this treatment. No scarring or visible scarring that you can see by any means, and very dramatic. But again, this patient really looks just like herself, just a little bit rejuvenated. And that's what most patients that are looking for face tight or AccuTite oftentimes, if we're treating, the double chin or jowling that we can often see, or the laxity that sometimes can occur in the face as we age or over time or after some weight loss journeys, we can really tighten and give you that shape and lift back to your face. Here's another dramatic result here for this patient. And again, just really treating right through those nasolabial folds here, and then the jawline really tightening. Another great example of kind of going in and sculpting or creating a jawline for patients. Now, oftentimes, myself included, this is just genetic, that sometimes we carry our weight in our face. I hear oftentimes from patients, like, no matter what I've done, no matter what I've weighed, no matter where I'm at, I always feel like I don't have a great sculpted jawline, or like, for me, I'll open my camera phone and I'm like, wow, I have a double chin all of a sudden, like this is terrifying looking at myself. And we can go in and just where that genetic fat sometimes hangs out, we can go in and sculpt. Another great example of just the natural aging process, sometimes the laxity in our skin just is no longer holding that fat where we wanted it. So being able to go and lift and tighten, same exact thing here with those jawline. And then another great example of really going in, debulking and building that jawline and leaving everything nice and taut and firm. So a lot of patients, even after having surgery or undergoing some dramatic changes, that skin is just really what's left and what's bothering you. You feel really great, you feel really confident, but you would feel even better if things could just be a little tighter and lifted. Another great example here. And then this one's going to be right through those nasolabial folds here. So some of the main signs of aging for patients that might cause them to want this. Another great one of jawline. And then here's a great one of kind of the overall. You can really see, again, most patients, whether it be body tight or face tight or acutight, people want to look and feel like themselves. Like for myself, example, when I was treated, I was not trying to be Kim Kardashian, like walking around in a crop top, running around, having everyone look at me, but I wanted my pants to fit better. I wanted to feel more comfortable during my daily activities. I wanted my skin to be tighter, like it was before I had a child. And so those are a lot of the things that we're looking to accomplish with these treatments, rather than making, you look like an entire new person, or where someone, says, oh my gosh, what, you had to have had something done. We want you to look and feel like the best version of yourself. Again, another great example of jawline. And then you can see here those hooded eyelids we're able to treat, so really offering an alternative to even like a blepharoplasty oftentimes for patients. Under eye here. Again, a really great one of that jawline and some of the laxity in the neck that we can see. Very dramatic results for this patient as well. Same here. And then last one of our jawline. We'll dive in here to the acutite, so that really small, precise one that we talked about. So some under eye bags, that's a great area, and most often what we'll utilize our acutite for. Jump there. You can see here, again, really opening with the under eye bags and the top lid for this patient. Really great results here. Under eye bags as well. Another one of just really going in and kind of targeting these smaller areas that maybe don't need that full size. For the face tight, we can go in and get nice and precise on very small areas. Same here, we talked a little bit about the bra fat. And now the body tight portion, which is my favorite always. So you can really see dramatic results for the abdomen here. Removing just a little bit of excess fat tissue, but also just leaving that skin nice and taut and firm and uniform. That's one of the things that's so great about the body tight itself, is that, of course, you have your absolutely amazing surgeons that, have been extremely well trained. They're exactly what you'd want doing this procedure, but the technology itself will monitor your tissue temperature as well to make sure that things are nice and uniform and even as well, just as an extra precaution so that things look and feel really good. You can see here some very dramatic results for sometimes those hard to reach areas. Just evening things out. We can also do breasts. So for patients, who maybe have similar experiences as this, we can go in and treat and even things out, again, without surgery, without that downtime associated. The arms are by far one of the most popular areas to treat. We hear so frequently patients that it's mostly excess skin, maybe excess fat tissue, but no matter how many workouts they do, no matter how much weight they lose, things like that, it really is just a lot of times that extra fatty tissue. And then, the arm surgery to have that skin excised can sometimes just not be appealing for whatever reason for patients, whether it be the scarring or downtime or anesthesia. But it's definitely one of the most popular areas we treat. You can see very dramatic results here. And again, just really seeing that skin tightening component is huge for patients. Oftentimes, if you're going with a liposuction option, you'll remove that fat tissue, but then you still have the skin, and then it's another surgery option most often. Another great example, again, of just really evening things out, making sure someone feels really confident. Another great example of arms. And then here is a great example to show off the table results for this patient. So just a couple months down the road, 3 months, you can see the matter of skin that is no longer there. Alrighty, if we're going to dive into the Morpheus 8, which is kind of like the sister of our radiofrequency assisted liposuction. It can be used as a standalone treatment, but it's also an amazing treatment to pair with your radiofrequency assisted lipo or your body tight or face tight. So we'll dive into this one. We talked a little bit about this, but as we start to age, we start to see some of these common things that are happening to our skin. Laxity in the skin, loss of tone and texture, fine lines and wrinkles. The fat that was once in certain parts of our face and voluminous has slowly started to shift to different areas. Our body, we see, maybe some laxity in our elbows, our knees, cellulite, stretch marks, the list goes on, and that is what our Morpheus 8 is really designed to treat. So the way that Morpheus 8 works is we use that radio frequency or heat energy that we talked about to go in, and we're going to melt away that extra fatty tissue, and we're going to leave the existing collagen and elastin or the existing skin nice and tight and firm. Now what we've done with this is we've just added in a couple of little pins or microneedles. So a lot of people are familiar with microneedling in the anti-aging space. It's been kind of a staple. The Kardashians really coined it as the vampire facial became really popular for a while. And it's just microneedling. Essentially all it's doing is creating these tiny little micro incisions into the skin. And what we're doing is essentially tricking your skin into thinking it's wounded. So our body naturally, if you think of any time you have a cut or a paper cut, gash, anything, instantaneously new skin starts to rush to that area. So we've taken that technology that we know to be tried and true to help with wrinkles and maybe tone and texture on the skin, and we've added that radio frequency that we've perfected with the body tight so that we can treat in even less of that invasive option to leave the skin nice and taut and firm. Again, we're really looking, you can do quite a few things. I call this one the magic wand. You can remodel fat, improve tone and texture of the skin, tighten. We can treat active acne, acne scarring. We can treat the body for stretch marks, cellulite, laxity, and then of course hyperhidrosis, which is excess sweating. So again, really kind of an overall magic wand, if you will. Again, one of the things that we do really well at InMode is we make our treatments customizable to our patients. So we just went through a lot of, things that we can treat with this technology, but we wouldn't necessarily want to treat, around the eyes if we're looking to tighten skin there, that we would, we wouldn't want to treat it the same as a thigh with cellulite or with stretch marks or extra, fat tissue. We want to treat them individually, and that's where our Morpheus 8 tips come in. So we have a variety of tips that each have a specific job. We can fluctuate our energy and how deep we're going into the skin to really look at exactly what you're wanting to do for your skin. So again, if we're looking to treat under eye bags, we have our prime tip that's absolutely amazing for treating crow's feet, under eye bags, rebuilding that collagen and elastin. We have our body tip. We have our Morpheus 8 that's tried and true, face, neck, chest, other areas of the body, and then our resurfacing tip that's great for patients that maybe have some acne scarring or some orange peeling of the skin is really popular to treat with this one. But you can see that some of these go 5 millimeters and even 8 millimeters into the skin, and that's dramatically deeper than your standard microneedling. Microneedling is FDA cleared to go 2.5 millimeters, and we're cleared to go 5 to 8 millimeters depending on what our tip is. So we're really getting into where that collagen and elastin can be shifted, can be changed, and that's what's leaving you with that rejuvenated, nice, tight skin. The treatment itself for Morpheus 8, so this is not going to be as extensive as your body tight or face tight or AccuTite. This is really designed for patients who maybe have already had that treatment, or maybe they have even less downtime than that week or two to take off for that social downtime aspect. This is going to be an in-office treatment. You're going to come in, you're going to get nice and topically numb. So no injections, no nothing there, but you're just going to use a nice topical numbing. And then the treatment itself is about an hour to an hour and a half. And then you'll leave, you'll look and feel like you had a bit of a sunburn, anywhere from about 24 hours to 5 to 7 days, just depending on how aggressive the treatment is and how your skin reacts. Typically when I have the treatment done, I'm treated on a Monday, I'm back up presenting on Thursday with just like a nice light mineral-based makeup over top. So very minimal downtime. This one I always say is like very social downtime. You wouldn't want to have your birthday party, but you can definitely go back to work on Monday and no one's going to know that you had anything done. This treatment is really designed to be done in a series of 3. So it's not quite as invasive as our body tight or face tight procedure. So we do want to build on those results. And this is really going to assist you with that skin tightening, the lifting, and the rejuvenation. So it's great to pair with your body tight, your face tight, or your AccuTite to see optimal results. It's also a great way to maintain those results over time with just rejuvenating that skin and keeping that going. We'll dive into some before and afters here. So before and after, so again, not as invasive and not as dramatic as the face tight that we've looked at, but still very great results for something that was just an in-office treatment, 3 different treatments 4 weeks apart. Again, you can see that collagen elastin rebuilding, so lifting, tightening. Another great example here for this patient. So you can really see the lifting of the neck and the jawline, overall tightening and changing of that tone and texture. This is going to be after 3 treatments. This patient is definitely a candidate for our AccuTite or face tight. With this, she chose to do Morpheus8, and you can see very dramatic results as well for her. Great example of kind of the crepiness that we start to see underneath the eye. Another good example here. So again, not as like mind-blowing results as maybe just your face tight or AccuTite, but you can see this is dramatic results for patients that want something that's going to be just a little bit of even less downtime. This patient is actually after just 1 single treatment of the Morpheus8. So I oftentimes get asked like, well, can I just do 1 and see if it works? We definitely recommend doing a series of 3. We're rebuilding that collagen and elastin from essentially the ground up, and so we want that to last you a long time. If you think about, our current collagen and elastin or our current skin, it's taken us quite a bit of time for that to start breaking down, and so we need to build that collagen and elastin up over those 3 series to last you, 3 to 5 years, unless you're constantly maintaining it with 1 single treatment every year to keep that collagen and elastin rebuilding. Another great example, this is actually 10 days following this patient's treatment. So after the treatment itself, typically you'll get what I call like a Morpheus8 glow about 2 weeks post. You're going to look and feel really tight. Your pores are non-existent. If we're treating the body, things are going to start to lift and tighten. But same thing as our face tight or our body tight, you're going to see optimal results about 6 to 12 weeks post, and then those are going to continue to get better up until 6 months or so. You can see dramatic results here of the neck. Really great results here for this patient. Some acne scarring. Another great example here, really just lifting and tightening for these patients. Again, going in, sculpting a little bit of a jawline for patients. Some more active acne scarring. Here's one of my favorites, really seeing those nasolabial folds. That tends to be an area where patients really start to notice that they're aging. Here is another great example, post 3 of lifting, tightening, and just overall, again, that rejuvenation where you look and feel like yourself, but you just look a little bit younger, tighter, brighter. All right, you guys, that is everything I have. I'm going to open the floor back up to you, Dr. Aragon, for any questions about either of the treatments.